And the new COVID-19 variant Omicron is driving up cases around the world and, of course, sparking a lot of concern. Dr. Angelique Coetzee was the first to raise alarm bells about this new variant in South Africa, has been since treating Omicron patients, and she joins us now from Pretoria. Doctor, we appreciate you joining us. We don't have a lot of time, but I want to be able to get the sense of how different this variant is compared to Delta, for example.
Good evening. I'm not sure whether it's night or daytime at your place. Thank you for asking us, Anthony. Very interesting viral infection that we are seeing, or clinical pictures that we are seeing with the Omicron variant. It's totally different from the Delta, especially in regards of the loss of smell, taste, oxygen requirements, as well as what we call a tachycardia, an elevated pulse rate that we have seen quite a few times with the Delta variant. So what is the symptoms? The symptoms is actually quite easy. Someone said it's very much like a cold or a flu type of symptoms. Yes, I think we can say it's very similar to that. So it's what we will say the body aches and pains, the muscle pain, the headache, and the tiredness or fatigue that would accompany it for about 1 to 2 days, slight sore throat, and that's more or less the majority of patients complain coming into the surgery. And why that is important to understand is if you are not on the alert or on the lookout for these type of symptoms, you would easily miss it. We're also used to Delta to seeing extremely sick and ill patients coming in. And with the Omicron, currently, the clinical picture is that of, as I've said, cold and flu type of, in regards of the body aches and pain. It's not, they don't have a cough, a severe cough, and don't have a running or a blocked nose, as you would see with your upper respiratory tract infections.
Important to notice, but when it comes to the overall transmissibility, I know the early days, but what are we seeing so far?
So it's quite fast spreading. Whether it's more transmissible than Delta, only the time will tell us once if we have reached our top of the fourth wave. But for now, it seems quite steep, but I'm not sure whether it would be more contagious or more fast spreading and at the end of the day. So we will know in South Africa within the next week or two. Our modelers are telling us that in the Gauteng region, we should see our peak within the next 2 weeks. And we can already see there's a slight or a decrease in patients coming into the surgeries.
The current vaccine, is that protective enough, do we know at this point?
So in South Africa, we only have Johnson & Johnson and Pfizer vaccine. It seems like they definitely protect against severe disease at this stage. We know that the majority of patients, 99% that was admitted in the Tshwane district hospitals, that's a public sector, was unvaccinated. So we will see going forward. But what we're also starting to get clearer regarding the clinical picture is that although it protects you against severe disease for the vaccinated people, interesting that if the vaccinated person come in and complain of their headache and their body aches and pain or their myalgia, they will say it's quite severe for them. But the unvaccinated, we have now starting to see quite a few unvaccinated people, where your vaccinated people will have a headache, a very uncomfortable headache. The unvaccinated people will have quite a severe headache, quite severe body aches and pains. And so there is definitely a difference between the severity of symptoms experienced by patients, although both mild. But the severity or the intensity, that may be a better word, is it's more intense in the unvaccinated people than the vaccinated people. Very interesting.
Can this be determined by the regular PCR testing and perhaps even by the rapid test? Or does it need to go for further testing to determine this variant?
No, Anthony, it is your PCR can detect it because there's a there's not a so normally your other COVID-19 variants will give you there's 3 genes, and this one has there's a lack of the S gene, so you can pick it up on a PCR. Once if you know what to look for, it's quite easy, so you don't need to send it away for genome testing or sequencing. So you can pick it up on the PCR, and yes, definitely on the rapid test. Just a word of caution on the rapid test. There's no, what we've also seen, if the patient started this morning, wake up this morning with this headache and this body ache and pain or this myalgia, and wanted to come in today for a test, on a rapid test, it would be advisable to wait at least 24 hours because you can, if you test too early, it's going to be negative. So, but anything from day 1, at least 24 hours of symptoms, up until at least 5 days, the rapid tests are very accurate. And thereafter, rather do a PCR test.
Okay. We appreciate this. We appreciate all your time and your insight with this very important issue. Dr. Angelique Coetzee, the chair of the South African Medical Association, we appreciate it. Thank you.
Thank you so much. Enjoy your day.